Hi, my name is Vonnie Stone. I'm a family nurse practitioner student at Auburn University. Today, I would like to talk to you about sympathomimetic drugs. They fall into the pharmacology class of catecholamines and analog of catecholamines. If they're synthetic, like dobutamine, they're known as an analog of catecholamine. When they occur naturally in the body, they're known as endogenous, like epinephrine, dopamine, and ephedrine. No matter the type of catecholamine, they're responsible for dilation of bronchioles, increasing heart rate and blood pressure, decreasing digestive system activity, and making sure that the liver converts glycogen to glucose. There are two mechanistic classes of catecholamine: alpha agonists, alpha 1 and alpha 2, and beta agonists, beta 1 and beta 2. It is not uncommon for a drug to be both an alpha agonist and a beta agonist. Examples of an alpha 1 agonist are those found in smooth muscle cell membranes, and examples of a beta 1 agonist are those found in cardiac muscle cell membranes. The medications that fall into this class, also known as adrenergic or stimulant drugs, are CNS stimulants like amphetamine, uterine relaxants like terbutaline, anorectics like sibutramine, nasal decongestants like pseudoephedrine, cardiac stimulants like dobutamine, pressor agents like methamphetamine, and bronchodilators like albuterol. Ding, 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 albuterol is the most commonly used bronchodilator. The action of these medications depends upon the agonist that is activated. An alpha 1 agonist is going to cause vasoconstriction. An alpha 2 agonist is going to cause inhibition of insulin release. A beta 1 agonist is going to cause tachycardia and myocardial contractility, and a beta 2 agonist is going to cause vasodilation and bronchodilation. The therapeutic effects include vascular smooth muscle contraction and vasoconstriction, and release of norepinephrine from sympathetic nerves. These medications partially or completely mimic the effects of the sympathetic nervous system, which means they're stimulating heart through activation of beta agonists and mimicking the effects of sympathetic activation by both the heart and circulation. This is also seen in the fight or flight action. This is when we see something and we either stand and fight or we run because our muscles become tense and strengthened and our heart rate is faster from the danger. Absorption occurs in systemic circulation. It's distributed into the blood-brain barrier in trace amounts, and it's unknown if there's anything to do with the placenta and breast milk. Metabolized in liver and other tissues, and excreted in feces, liver, and urine. Used precautiously long-term, because long-term use increases the mortality rate of heart failure patients and can precipitate myocardial infarction and stroke. These medications are contraindicated when someone already has cardiovascular risk factors because it causes adverse drug reactions like palpitations, tachycardia, increased blood pressure, dry mouth, headache, rebound effects of nasal decongestants, etc. Drug interactions between tricyclic antidepressants tend to increase the vasopressor response to sympathomimetics such as epinephrine, etc., and beta-adrenergic antagonists generally antagonize the cardiac and bronchodilating effects of these drugs. These medications are used basically for heart failure, any kind of shock, hypertension, and any condition where you need to raise the blood pressure. Epinephrine specifically is used for reversing the effects of histamine and other allergic reactions. That's why we have an EpiPen. The rationale for using these medications, again, is for where there's conditions that it's appropriate to raise the blood pressure and stimulate the heart by inducing vasoconstriction. You must monitor these patients very closely because it can cause cardiac arrhythmias, excessive cardiac stimulation, along with the usual suspects, hypertension and high heart rate. Must use these short term. Patient education: you cannot take these medications for long periods of time. You have to make sure that you are watching those patients that have any type of cardiac myocardial activity. These medications are administered inhalation, intranasal, intravenous, sub-Q, and IM injection pathways. For lifestyle management, these medications, when it comes to amphetamines and methamphetamines, affect those folks that are trying to inhibit their hunger, stimulate energy expenditure, cause lipolysis and fat oxidation, and reduce their appetite and increase their energy expenditure. The main takeaways for these medications is short-term use only. Long-term use is going to cause mortality for heart failure patients. These medications are used for heart failure, shock, hypertension, and anaphylaxis. Don't forget the EpiPen. And IV, IM, subcu, intranasal, and inhalation are the other ways to administer. Toxicity occurs within minutes after IV administration, like with cocaine, and they can cross the blood-brain barrier in trace amounts. We don't know about the placenta and breast milk absorption, and always know that these are also known as adrenergic and stimulant drugs. Thank you.